Hi, I'm Catherine, and today I'm going to be showing you a little mobility exercise for the whole of the spine. This one particularly focuses on the lumbar spine, that's the lower back area, and the thoracic spine, that's more through the middle of the back, the sort of rib cage area of the spine. So in this video we're going to be laying on our backs, and we're going to need a couple of towels, just a couple of hand towels, one rolled up, and that's going to be for placing between the knees just to isolate the movement a little bit better, and one just to rest your head on. You might want to grab a mat and a blanket to lay on, and also put some nice comfortable clothes on so that you feel nice and free and able to stretch. So this exercise is pretty safe to do for most back conditions, but it's always good to check with your physiotherapist first. If you find the exercise is painful after 3 or 4 reps, if it's starting to get more painful, then please stop and perhaps try a different exercise or have a chat with your physio. So the exercise is called rotation in lying, or sometimes it's called knee rolls. As I said, nice and simple, so let's get started. Okay, so hopefully you're getting nice and comfy. So little towel to support the head, knees bent up, feet on the floor, and then the second towel is to place between the knees. It just gives you something to grip onto and help you to get the maximum rotation from the spine rather than compensating elsewhere. So keep a gentle grip on the towel. Arms relaxed sort of by your sides. You can have them as high up as T position if you like. I'm just going to keep mine relaxed by my sides, is because I haven't got much room here. So first of all, we're just going to warm up the pelvis, warm up the lower back. So press the lower back into the floor to round the back, and then arch the back away from the floor. You just get some nice movement into the pelvis, warming up the lower back to begin with. And then find our neutral spine position. So just resting sort of halfway between the two, and engage the abdominals. So think about switching on the tummy muscles. Then we're going to rotate the spine to the right. So you're going to turn the knees towards the right, keeping a grip of that towel. And you're peeling from the waist to the armpit. So from the left side waist to the left armpit. And then take your gaze towards the palm of the left hand. As you come back, you try to move from the armpit on the left side towards the waist. One rib at a time if you can. Pausing in the middle, take another breath in, and then on the out breath, you're moving from the waist, again to the armpit, and then taking your gaze towards the opposite hand. So looking at the right hand as the knees go over to the left side. Take a deep breath in there, and on the out breath, coming back, armpit to waist, one rib at a time. So if your back's particularly acute, you might not manage a full rotation. You might just want to do a little small movement at first, almost like a little rocking side to side. And as your back warms up, so perhaps after 4 or 5 reps, just increase that movement so that the knees come all the way down. Okay. So with this exercise, 8 to 12 to 20 reps, whatever makes your back feel good, really. You want to make sure that your back's starting to feel more comfortable as you progress through the repetitions, rather than getting more painful. So if it gets more painful after 4 or 5 reps, then stop. It should start to feel like a nice stretch, not a nasty stretch. You could then develop it into more of a stretch at the end. So as you take your legs over and get rid of the towel, and then so you're over towards the right, so you place the right heel over the left knee just to increase that stretch. So you've got the weight now of your right leg, just encouraging that left knee to rotate further over, and then just letting your gaze again look towards the left arm, and then unlock the knee and rotate back. And then you can repeat to the other side, so rotating over, and then bring the left heel over the right knee, just to encourage an extra stretch, sort of all the way through the outside of the hip. Just be careful if you have any sciatica, so it's probably not a good idea if you're getting any leg pain or buttock pain to hold a stretch like this for long. You're better off just doing the knees side to side in the early stages of sciatica. Okay, and then just release the lock, and then come back to the midline. You should be feeling a little bit more flexible, a little bit more loose, a little bit more warmed up now. So I hope you found that exercise useful. Hopefully your back's feeling a little bit freer now. If you did enjoy the video, then please give it the old like, the thumbs up button. And if you've got any questions or comments to make, then please do so in the comment section down below. If you'd like to watch more videos like these on common musculoskeletal complaints, then do click the subscribe button, and I hope to see you on the next video. Thanks again for watching.